So in tongue diagnosis, we look at several things, such as the shape of the tongue, the color of the tongue, and the coating or the fur on the tongue. A lot of people like to scrape their tongue fur, and it's a good thing for oral hygiene and for not having bad breath. It's great. In terms of Chinese medicine, I always ask my patients, give me a week to 2 weeks without brushing your tongue, come back in and see me. I want to see what that tongue fur looks like. Then you can scrape it, and then maybe a month or two down the line, I'll have you redo it where you don't brush, or don't scrape. Oh yes, absolutely.
I do my tongue and I still see fur.
Yeah, so it's rooted to the tongue, which is a good thing. But I always want to see, because it'll grow back. Some of it inevitably will come off when you're scraping it. Yeah. So looking at shape, these are some common examples. Is it thin? Like the whole volume of the tongue is thin. When you look at the tongue and they stick their tongue out, it doesn't occupy the whole space of the mouth. It's very thin. That usually says it's a yin deficiency because there's not enough yin to fill it in. Is it enlarged? That's when they stick their tongue out and it's like popping out the sides of their mouth. This tells you that there's dampness involved because there's too much pathological fluids. Or it just tells you there's an excess condition in general. Like too much heat could cause that. Or too much heat is just filling it in. It's bringing too much circulation there. Scallops, also known as tooth marks, are where there's little ridges on the edge. That tells you a pancreas qi deficiency as well as dampness there. The reason it tells you both of those is that the dampness is filling it in and it's making it larger. They're generally enlarged when you see scallops and tooth marks. And at the same time, the qi of the spleen, the pancreas, spleen's bad translation. Sorry, pancreas. The pancreas qi is not filling in the tongue enough, so it can't keep its full borders. So it's both of those together. It's not my favorite explanation in Chinese medicine, but it works. Any questions about shape? Pale color of the tongue, just like before, tells you cold or blood deficiency. Red color just tells you heat. Whether it's excess or deficiency, you can't really tell. Well, there are ways to tell, but we're not going to go into it now. If it has a purple quality to it, if it's a really strong purple, it tells you that they have blood stasis in their body somewhere. The blood isn't circulating well. If it just has a slight purple, that's what we call dusky, and that tells you more liver qi stagnation.
I heard yellow. You said yellow.
Not with the color of the tongue,
Oh.
of the tongue body. There's yellow for the fur, though.
Oh.
Yellow for the fur tells you that there's heat. But you always have to ask them, like, did they just eat Indian food and have a lot of turmeric, a lot of curry?
Can you repeat that about the yellow again? You said the yellow fur.
Yeah, the yellow fur, it usually tells you that there's heat involved, but you always have to be careful with what they ate. You know, even drinking coffee can change the color of the tongue coating.
Now, does that mean that any heated beverage will cause it to be yellow?
No,
Okay.
no.
Just certain.
So when foods and drinks change the color of the tongue coating, that's just based on their normal color of that food. But if you put that aside and you're just looking at their internal constitution, if they have heat in their in their system, then the tongue fur will be yellow.
Okay.
For instance, if someone gets bronchitis, which is a heat condition in Chinese medicine, their whole tongue coating will turn really yellow. That's because the bronchitis is so hot that it's reflected in the tongue fur. If there's no fur, since fur is a fluid-based substance, it means that there's yin deficiency. Then there's a greasy fur where it looks kind of mucousy and moist. That tells you that there's dampness, or there's phlegm, or there's food stagnation. That's when that food stagnation leads to that amma that we talked about from Ayurvedic medicine. And with this great picture of the tongue, there's different parts of the tongues that correspond to different areas. The tongue tip, the very tip is the heart. So we're at the top of the body here. Whereas the way back of the tongue is the kidney and the uvea and the intestines, which is the way lower part of the body. So it mirrors that. Heart at the tip, then lungs right behind it. On the two sides are the liver and the gallbladder. And in the center is the spleen and the stomach. Remember, the earth element in the 5-element model can be put in the middle because the earth nourishes everything. Good? Nice. Now this will be really fun. Let's look at some pictures. Okay. First thing to notice, look at the side. Those are the scallops or tooth marks. Like we said, that's pancreas Qi deficiency and dampness. The coating, it looks pretty normal. A normal coating is just like a thin white fur over it. That's fine. Can you tell that there's a little bit of a slightly purple quality to it? Can you see that?
Towards the back?
You can like see it here
Yeah.
a little bit. More so here and here you can see it. That tells you that there could be some liver Qi stagnation going on. Could also be cold. That's another common thing, where the cold is starting to slow and constrict the flow of Qi, the movement of Qi. This tongue is more pale, and that tells you the blood deficiency or cold. More on the pale side. Notice as this person is sticking out their tongue, it's like overflowing out the size of their mouth. Right? This is an enlarged tongue.
What about the creases in the middle? Does that mean anything?
So cracks, tongue cracks, could mean two things. Either it's normal and it's their constitution, or otherwise it could mean actually a myriad of things. I personally don't like using tongue cracks as diagnosis because it's so hard to tell whether they really have something going on or it's their constitution. It's not very clear in the diagnostic picture. But for instance, sometimes they'll have a crack all the way from the back, all the way straight up to the tip. That is one that sometimes I use. That's kidney-heart disharmony, where the kidney isn't giving enough yin to the heart, and then you get those insomnia symptoms where they wake up in the middle of the night and can't fall back asleep. I know I'm giving you guys a lot here. Good. Okay. This is a red tongue with a little bit of purple in it. Can y'all see where there's fur right here, but then there's little patches where there's not, for instance, on the left side and towards the front? See that? That's what we call a geographic tongue, because it looks like a continent here and then a body of ocean called geographic. That is an earlier stage of yin deficiency. And if you were to look closely, the fur that is there back here has a slight yellow quality to it. So that could be another thing that could indicate a little bit of a little bit of heat. But the tongue color automatically tells you that there's heat going on. So if you were to put all of this together, it tells you that there's a yin deficient heat going on. It's hard to tell from this picture, I wasn't sure, but his tongue tip may be just a little bit redder, maybe. So again, that could be heart heat or possibly lung heat. Greasy yellow fur right here. Actually, it's kind of hard to tell whether it's greasy or dry yellow. I imagine this is a greasy fur, but you can't really tell from the picture. The greasy would tell you the more damp phlegm or food stagnation. Dry just tells you that there's heat that burned out the fluids.
Greasy means that it sticks together more?
Greasy means it looks mucusy.
Okay.
Then she has what's called a strawberry tummy. Little prickles all over it. That tells you heat. It's usually a stronger heat.